that and then copy those modules and take them into an expansion. So specifically, the age of diagnosis is significantly in younger women, so we really need to educate women early on. If you want your patient to come at the age of 40, I think we need to target our education now for those women in their 20s, even women in their high school, just to prep them very well. By the time they reach the age of 40, they will be willing and voluntarily just walk forward and get their mammograms done or do their screening. And avoid the temptation to transfer the recommendations for other countries to developing countries, because the setting is totally different in many aspects and in many political, governmental, cultural, so we really have to be sensitive to the local needs. So draw insights from past research, but local investigations are very necessary and they're essential. And support is needed for organized programs to assess the impact of those interventions, just to measure our work, just to make sure that we are moving in the right direction. Once something is implemented, it needs to be tested in the local settings. So the bottom line, until now we cannot prevent breast cancer, we're not yet there. However, we can offer early detection for breast cancer by screening. So probably at this stage now, screening mammography is the gold standard. There's room for improvement. You know, they talk about tomosynthesis and it's like really great and it would decrease the recall rate, and the target is screening for high-risk patients. And as you know, I think Dr. Khoury have alluded to this study where there are some specific indications and recommendations for screening. I would encourage whoever is interested in working on screening mammography or screening programs to read this study. And it's very important when you are working with screening to have to see the light at the end of the tunnel. If you want to screen a woman and diagnose cancer, you need to be able at the same time to provide a center that can give treatment and follow up. So that's what